Hi, my name's Greg Lybeck. I'm from Walla Walla, Washington. Past patient here. I'm 61 years old. I had a big tumor in my mouth by the time the radiation tore it down. It was about the size of a golf ball. I had a hole in my mouth, and then I had a little reoccurrence where it got infected. This wound was probably the size of a silver dollar or bigger in my mouth where everything was attached. And apparently to my doctor in Seattle, he did biopsy because I thought it still might be cancer. It wasn't. It was narcosis, which is dead tissue. His thought was hyperbaric treatment would be the only thing that could help heal that. And when I started this treatment, I was optimistic that I could, because basically I wasn't able to eat at that point in time. I was still on a feeding tube. I think I lost my feeding tube within the last 2 weeks of my treatment down here. You know, I was weak. I just wasn't physically very good shape, and I had an infection. I was fighting an infection in my mouth, so I was looking forward to the hyperbaric treatment. When I got down here, it took a little bit of time, and I remember thinking 40 trips from Walla Walla to here was going to be a tough thing. It ended up not being tough. It worked out great, but as I started coming in here, I started to feel results maybe in about 2 weeks, but they were small, they were minor, and I was anticipating quick results, which I know I shouldn't, because I know that that's not the process here, but I ended up getting out in 40. The treatment, I got scoped by my doctors not long after that, and the wound had almost completely healed. I was eating again before I got out of here. My eyesight actually took a jump for the better. I probably gained about 8 years, maybe 10 years in my eyesight, which that wasn't going to be part of it, but that was maybe like the silver lining in this whole thing. So my eyes got better. I'm starting to eat again. I'm gaining a little bit of weight, getting stronger. So I think the treatment itself really did a great job. It worked well. Coming into it, worried about the chamber because I'm a little bit claustrophobic, and I was like, I know it's going to be tight. As I found out, I was very comfortable. I mean, I came into the chamber every day. I got all my stuff off that I needed to get off. I hopped in it, and they put TV on for me, and no phones, you know, no computers, nobody asking you questions about your work. It's pretty therapeutic, really. My wife did research on it, and I think when they're looking at Seattle, looking at Yakima, looking at Tri-Cities, she did research and found that Dayton had not one but 2 hyperbaric chambers, which she started doing research, and we started talking about it, and it came to the conclusion that that would be the best place for me to be. And I think for a lot of reasons, after I got all said and done with it, it absolutely was the best choice for me to be here. I think I chose Dayton over Tri-Cities just because I think the drive itself, and then the size of the hospital. And I think once I met the team, I felt comfortable, right? I just felt more comfortable to drive here and to do it here and to be with this team. I think I met with the team in August, and I had a good feeling. I think what I learned through that whole process is there are systems in place, and they might be the same as there are in a big city to a little city. So I was content with being in Dayton with this team. And I think this team, even though they're from a small town, small hospital, I think their ways of doing things are the same and as great, or if not greater, than a big hospital. Every single day, you know, it wasn't like, oh, we're busy doing this, we're busy, you know. They gave me their 100% every single day, and you know, I'm still grateful for that. I think they're focused on my health, and I would make that decision today over and over and over and over again. I wouldn't change and say, oh no, I'm going to do that. I was completely comfortable, and then after I got through with 40 trips in the chamber, you know, I felt like I had a family down there. But you know, I felt really comfortable with them, and I think they just did an exceptional job, and I would recommend them for anybody to come. The thing that I didn't understand is if I get a cut, if I get a wound, it heals itself, right? And come to find out through this process that my wound in my mouth, it kept getting infected. It would not heal itself. The only thing that would heal it would be the hyperbaric treatment. And because of the oxygen level that it pumps in and stuff, it heals the tissue. So it reversed itself. But I think that was surprising to me, because I think when I first heard I had to do it, I thought, well, why won't I just heal? and they said, it won't heal. That was the biggest thing that I didn't understand, that I learned before I went through the process, that I really needed to do it or I just wasn't going to heal. I wasn't going to heal, which means I wasn't going to eat, which means I was still going to be on a feeding tube, which means, you know, I was going to be light on weight, worrying about losing too much weight, you know. So I think, you know, once it was explained, it was like, oh, okay, you know, this is something you got to do because there's nothing else that's going to heal this thing.